Hello, Section 5. I hope this video finds everyone doing well for week 2. Good morning, good afternoon, good evening, wherever you are when you're listening to this. As just a quick weekend wrap-up, man. My last one was too long, and I apologize for that. 12 minutes, man. I want to keep this under 10, somewhere between 5 and 8 if at all possible. I don't want to waste more of your time. You guys have done a lot of work this week, and I want to be brief and to the point. But I do want to take time to kind of highlight some of the more salient points that we talked about this week. So, in regards to HipOA, the Handel article, I thought that it's a really good article. It helps really bring in a lot of the different techniques that we use, and it allows you maybe to share with your colleagues some of the things that you're learning in this course. It really speaks to the general versus the specific, the impairment-based approach versus a more treatment package-based approach. What is the best way? Ultimately, the best way is whatever's best for the patient, and however the patient responds. Impairment-based certainly gives us more of a feeling of confidence, knowing that we're treating very specific things. But ultimately, I don't know. We used to think that it was really important that we have a bunch of special tests for the lumbar spine and the SI joint, and that's really been proven false. So maybe we need to be more general in our approach. Maybe it doesn't matter. I think the research will kind of eventually tell us where to go, but as I tell my students at the University of Minnesota, or when I'm teaching at St. Catherine's University here at spinal manipulation, we want to be as specific as we can, knowing full well that we're not, but that does not give us an excuse to be lazy. So I guess we'll continue with the jury on that. Lower extremity nerve entrapment article by Anderson was the presentation was really good. And if you guys have done maybe just slump sitting as an assessment, this is an opportunity to have different ways of assessing neural structures, and I use these quite often because I believe that these structures are at play in a lot of cases, but usually clear up when you mobilize the joint above. So for example, saphenous nerve or even sciatic nerve, mobilize hip, a lot of that stuff gets better. Saphenous nerve, if you inferior glide the hip, sciatic nerve, posterior glide hip, clears up a lot. You manip proximal fib for any of the nerve structure that goes posterior to the knee or distal to the knee, and you can get a lot better mobility. A talocrural manip, another example. Well, those are things that you'll talk about in the weekend intensive. Manual therapy hip disorder is the one that Whitman, the presentation that Julie Whitman did was really good. I know Cameron McDonald. He was in my fellowship program at Regis University. He was one of my guides, if you will, and his case series is great. I think the Altman hip criteria is just one of those things that you go back to as a staple for why you have hip loss, range of motion. It's certainly an article that physicians, it resonates with. So when you're selling these treatment techniques and when you're telling, hey, don't send them to surgery, general practice, or primary care, send them to us. Remember the Altman hip criteria? And they'll be like, oh, yeah, I do vaguely remember that. They'll know about that. Buttock pain, the Vasduvin article. Buttock pain originates from SI, LS, lumbar spine, and hip. Remember that. Remember that buttock pain is a multifactorial thing, and you should be very clear to go after each of those areas and not forget one. Bursitis and lateral structures of the hip, he talks about that, and it makes me cringe. I've got some really solid stuff on bursitis that really refutes that, and I've even, along with another section lead who we've done some CE courses here in the state of Minnesota, we have a presentation on greater trochanteric pain and what that really represents. And there's just an article that came out refuting bursitis again. That's kind of an old school mentality, I think. That was one of my criticisms of that article. And then I spelled ITB pain syndrome wrong. My apologies. I just want to bring out that the iliotibial band pain syndrome, that's a bit of a sticky wicket. Obers, Nobles, and Renee have, suspect validity to them. Are they really testing what we think they're testing? Obers has good reliability, so that's good to see. But I think ultimately strengthening the butt, loosening mobilizing the hip joint, stretching the hip structures around the hip joint are ultimately your key out of that issue. Maybe some soft tissue of the iliotibial band. Standout post this week. Alicia and Cheryl's thread on sliders versus tensioners, that was a really great. And then prioritizing patient problems. I thought that was really good, as Alicia and Cheryl were kind of talking about that. How, if you have somebody who's really complicated, where do you go first, especially for new grads? I think some people who have maybe been doing this a while have a better handle on that, but new grads especially can be very overwhelming. And I love that exchange that went on, because it is important, and Cheryl gives some really good advice. Ray has a great discussion regarding using technology, challenging patients on how to gain compliance. My apologies. And Justin, I really liked, Justin and I had an interesting discussion about the generalized versus specific approach in the Handle article. And again, I'm not saying one's right or the other. I have my biases per se, but it's good to dialogue, right? It's good to engage in conversation. And right now in our profession, very few times can anyone really stand on a high ground and say you're wrong and I'm right. But we can certainly critically think and challenge ourselves and use our patient experiences to gain a greater insight into where we're going. I really like Corey, Jess, and Joseph's discussion on saphenous nerve glides. I think those are vastly underappreciated with medial knee pain, especially with our patients who have knee OA, and we'll talk about more of that as we move along in this course. But I think it's a great skill or assessment tool to have when looking at those. So next week we move off into some more FAI, labral tears, and groin pain. So some similar topics that we'll be talking about. Nesting. Guys, very few people were able to nest their posts one on top of each other. I had to remind a couple people. Some people were able to change. So again, the first person to post in the group, the second person to post, don't start a new topic. Reply to the first person's post. So we get one continuous thread. Again, if you don't understand, please let me know and I'll show you examples from this week that you can utilize to help get a clear. As a matter of fact, if we were to look here, like what Corey did, I'm going to show you actually if I can quick do this. I didn't plan on doing this, but I just want to. If I go down here to alpha, and if we look at, I believe, Alicia, for example, posts. I was able to post a question here, but Cheryl posted hers right under Alicia's. And if you can all see that, that's what I'm going for, okay? So let's think about trying to do that. And I know this might take a couple weeks to get everyone on board, but see how Cheryl just replied and then did her original post, and I was able to read her stuff, and we have this kind of continuous thread with a really nice dialogue with all three of us. And I'd like to get all the people in the group doing the same thing. All right, now if I bring this back up. So continue the great discussions. Some really good stuff this week, you guys. Some good banter. For those who, again, try not to post Saturday morning, try to get in there before then. Let Saturday morning be a way of clearing out the threads, making sure you've answered all the questions, and then kind of finalizing the discussions. Look for fellowship discussion. I'll be posting my comments on the fellowship case studies probably tomorrow. I don't know if I'll get to them tonight, but probably tomorrow. Read them. Again, not mandatory, but if you get a chance, it's really good practice. Hope you all had a great week. Look forward to seeing your stuff week 3. Enjoy your weekend, and we'll see you online.